there's nobody to dispute his testimony that he called and made these calls 3 times, and I have evidence that he provided from the beginning Medicaid for my child. Why would he withhold that information? Who wants to pay for medical that they're not responsible for? It doesn't even make logical sense. So I don't believe that you tipped the scale. So for that, your claim is denied.
The healthcare industry exhibits a strange dichotomy of ability. They can perform robotic surgery over the internet with 1,000 miles separating surgeon from patient, but the billing department doesn't seem to know shit from shine-ola. Today you'll see 2 prime examples of corporate greed and stupidity. Stick around for the second and tell me if you think the nursing home is trying to scam its way into $13,000. After all, LeRoy definitely couldn't be in 2 homes at once. Let's roll nerds.
Is there a provision in that assignment of benefits and medical release wherein Mr. Lerma acknowledged and agreed to pay all amounts that are not covered, partially covered, or denied by his insurer, as well as any deductibles and or co-payments?
Yes.
Ms. Johnson, does Hope Network as a provider accept Medicaid coverage and bill Medicaid as a form of insurance?
Yes.
At the time defendant presented the plaintiff to seek out services, did the defendant provide any insurance coverage information whatsoever, be it primary, secondary, or both?
Primary, yes.
Did the defendant present any secondary medical insurance coverage information?
No. And the later of you taking care of it wasn't until after you got a bill?
No, I called them about 3 weeks later and went over the insurance and they transferred me out. And then when I got
They called you?
No, I called them.
You called them?
They've never called me.
And you went over the insurance, meaning what?
We gave them the Medicaid information.
So you're saying 3 weeks after that, you called them and gave them Medicaid information?
We called them.
What number did you call? Who did you talk to?
We called the main branch in East Lansing.
So you're saying you called Hope Network in East Lansing?
Yes.
What information did you give them?
The Medicaid number on the card.
Okay. What prompted you to do that?
My old lady reminded me to call them.
Okay. And then what happened after that?
They said they would rerun it and rebuild it. And then I didn't get anything or calls or emails or anything from them until the first bill came. I called them back. They transferred me to Grand Rapids to a finance area. They said they would rerun the information and they would bill me again. And then I just never heard anything else from them. And then it wasn't until I was doing my credit checks in the springtime, I seen a bill on there and I didn't know what it was for. I started looking into it as Hope Network. So I contacted them and asked them for a copy of the bill, and they sent me the information for the billing and still only showed the Blue Cross Blue Shield. So I called back and said, you guys didn't rerun insurance. And then the court papers came up 2 weeks later.
Okay, what else did you want the court to consider?
Well, I brought this paper, it just showed the email communications, like the dates. It's just a lack of communications or emails.
Emails between whom?
Us and Hope Network.
Oh, did this purports to show when you emailed Hope Network?
It just shows when they were emailing me, like there's never any billing in here. It's for enrollments and just non-communicative stuff that do anything with billing. But
oh, okay. So you were receiving some emails from Hope Network and you're showing me that you didn't get anything that had anything with the bill.
Correct. And the other thing I brought was my Medicaid claims, just to show there was no claim from Hope Network and that it was covered during that time period.
I believe that they didn't bill Medicaid for that. Now, where you have to show me is where your burden is to show evidence that you provided them with the Medicaid information.
And we only did that verbally over the phone and in person. That was it. So there's no physicality to it. Or email.
There's no dispute of fact that no number was provided for his Medicaid secondary insurance information at intake. As we heard the defendant testify, there was a discussion with the plaintiff that he had secondary Medicaid insurance information that would be provided at a further and later date. But if we look at Exhibit 1, clearly, that's what information he presented to plaintiff at the time of intake. Second, we heard Ms. Johnson testify that the plaintiff, based upon the primary insurance information that defendant provided at intake, billed his primary insurer after services were provided and rendered to the minor child. We heard Ms. Johnson testify, and we also introduced into evidence Plaintiff's Exhibit 3 that documents that his primary insurer, Blue Cross Blue Shield of Michigan, was billed and that it remitted some payments. Also introduced into evidence in plaintiff's exhibit number 2 is exactly what the defendant presented at intake. A copy of his driver's license and a copy of his Blue Cross Blue Shield primary health insurance card. Nothing more. And that's confirmed by the defendant's testimony himself that no Medicaid insurance number was provided at intake. The absence of any calls in plaintiff's exhibit number 4, supported by Ms. Johnson's testimony, supports the fact that the defendant never called or contacted or wrote plaintiff or provided any Medicaid insurance information for plaintiff to bill his secondary insurer.
EPSDT.
EPSDT,
That's the Medicaid autism. Like the,
and this is for specifically for autism, is what you're saying?
Medicaid autism.
Okay, continue.
In your
I'm
honor,
gonna let him. I don't want you to cut his train of thought. I'm gonna look it up myself because I never heard of it.
to the extent though that these guidelines have not been admitted into evidence.
If it's law, he doesn't have to admit evidence of law. He says this is the guidelines. He doesn't have to admit it.
He cited no law, no compiled law, no statute. He's just stated that
If it's a regulatory law, if it's a policy, he doesn't have to provide that as an exhibit.
I would agree, but my objection
I don't even
is
know what EPSTD stands for.
I don't either. And the defendant hasn't testified or provided any testimony that would support his claim other than he read something and there it is.
Well, that's what he's doing right now. He's telling us what it is.
But the time to have done so properly would have been his testimony when he's presenting proofs. He's giving up.
This is not the first time I wrote it down earlier, and then he did mention it in his testimony.
I would have just object on the basis that he hasn't filed any affirmative defenses upon which he now seeks to rely in his closing statement.
It's a mandatory Medicaid benefit for children.
Okay, so your understanding of some regulatory law or rule is that if a person's seeking evaluation for autism that are on Medicaid, they only need to mention this?
Verbally mention it, and then they're supposed to contact CMH. Between the two parties, they're supposed to contact CMH. From what I read, I'm supposed to call them first, kind of knock on the door, and then I mention it to them. They're supposed to call them and make sure it's approved for Medicaid.
You're supposed to call who first and knock on the door?
I'm supposed to call CMH to get the door open. That's how it was read. And then they call CMH on the backside to check for the approvals, because CMH has to approve the Medicaid bill. But the policy says that if you verbally mention it, that they have to stop doing what they're doing and make sure that you're approved by Medicaid for the program.
I don't know if they're supposed to call CMH or not. I believe, though, that my understanding is that they can look up whether or not you have Medicaid. I don't know why this entity couldn't look it up. My understanding is that they need certain information. They can look it up in a system. That's my understanding.
We take our daughter to emergency services without it, and they find it just fine multiple times.
That's my understanding is that they have a system that they could look it up in. She's saying Hope Network doesn't have that system.
We need to know that he has it. I didn't know that he had it.
Well, you weren't the person he spoke to. You're senior manager of this. So he wouldn't have spoken to you anyways. If he had a call and said, I want to speak to a manager, it's highly unlikely they would have put her on the phone.
I only brought this to court because I knew that I followed what I was supposed to do. I made the phone calls. They said I would do certain things and it never happened. The first time we came in, you and I were on the telephone conference, and I told you that, and you said, no, I believe you, but that's not what it is. We don't have to bill them. I know I did what I was supposed to do. So to me, it was a principle thing on my own side. So I did what I was supposed to do. I didn't get billed for something that he did what I was supposed to do.
All I have to rely on when it comes to whether or not there was ever calls made outside of this is testimony evidence. And you provided your testimony. There's nothing even to dispute. There's nothing here to say, no, there was no other calls. Because you provided a witness that only can tell me about the record of these calls, but not anything that says, no, he never called any other time. There's nothing there. So you're not tipping the scale yet. You and your wife, significant other, bring your child for care. Your testimony is that you tell the representative at intake that you have Medicare. or Medicaid, that is correct. And that you're told that you could provide that information at another time. I don't know why that wasn't transferred here. It would not be, though, his responsibility to transfer it here if he said that he told them that I have Medicaid. I don't have a reason to believe that they wouldn't say they had Medicaid if they had it. You did authorize to be billed in this form. You receive a bill, and that bill is not reflective of Medicaid, to which you say you call a second time. This time you must be still calling the Lansing office, but this time you say you're transferred to the office or in Grand Rapids. You're told you'll be rebilled. You don't get another bill. You assume that's because they billed it and it's taken care of. I don't know who you would have spoken to during these times, but I believe you called. I also believe that you told them from the beginning that you had Medicaid. From the first time, I think you've been pretty consistent. Well, I told them I had Medicaid from the beginning. They told me I could give them the number, and then they never rebuilt. And so now telling me that because he didn't speak to the right person, or that there was no note put into this special eCares account, that somehow falls back on him, I have a problem with. Because it was up until today that the plaintiff continuously took the position that they didn't even have to bill Medicaid, that it was a courtesy billing. That was your absolute position up until today. And I believe that was the position you were taking, but you're faulty in that reasoning. It's not a courtesy billing. If they tell you they have Medicaid and they provide that information, then you have to bill the Medicaid. But because you took the position up until today that it was a courtesy and that it didn't have to be dealt with, I have to discredit whether or not you did, in fact, get this information that your client decided they just was going to treat it as a courtesy. Because that's the argument that you continuously made this entire time. It was a courtesy. It's not a courtesy. You're absolutely required, if the person has Medicaid, to bill the Medicaid. And then you can't even bill them for any extra after it. He provided another insurance, so it should have, we would hope, covered it all. But I don't know where his phone calls went when he called Lansing and they transferred him. But I know it probably wouldn't have went in the eCares account unless he was talking to her department. Everybody's not using eCares over there. There's nobody else here to dispute his testimony that he called and made these calls 3 times and provided this information that he told these people in the beginning. And I have evidence that he provided from the beginning that we had valid Medicaid for my child. Why would he withhold that information? Who wants to pay for medical that they're not responsible for? It doesn't even make logical sense. So I don't believe that you tipped the scale even enough. I think at bare minimum we're even, which means I can't give you the relief you're granted or you're seeking. So for that, your claim is denied.
I just want to clarify though one point.
Yes.
Our position in this case has been that after a year, if a patient provides no information, insurance billing information, within a year from the date of service, after a year, whether it's Medicaid or primary insurer, provider cannot and does not bill an insurer.
I'm clear on that. That wasn't the argument that was made.
That was
the argument that was made was that it was a courtesy billing and that we don't have to. That was the argument. I can tell you the date it was made the first time, because that was what you relied on, or whoever was in your stead back on February 2nd. That it's a courtesy billing to bill insurance. We don't have to bill insurance. That was the original argument.
February 2nd of 2025.
2026. This case wasn't filed in 2025.
Well,
at this point, I've made my ruling, and so I got to move on because I have a whole nother trial to start. It's 4 o'clock.
Understood, Your Honor. Thank you.
Thank you.
Salado Creek versus LeRoy Owens and Teresa Owens. So I did look at this, like I said yesterday. You were taking care of Mr. Owens?
Me personally, no, it was my nursing home. I am the business office manager. So Mr. Owens was in the nursing home, in Salado Creek Nursing Home.
All right, so go ahead and proceed.
Yes, so my name is Salma. I'm the business office manager at Northeast Rehabilitation. Mr. Owens was there from November 2nd, 2023 to, he was there for some months. And whenever he first went in, he had the insurance Medicare A. For Medicare A, the first 20 days are covered 100%. And on day 21, there's a copay.
So $200 a day?
After day 21, yes, correct. If a secondary insurance covers that, such as in Medicaid, they cannot pay out of pocket, which is mostly out of most people.
And did they have that?
They did not have the funds to cover for it.
So they didn't have a secondary insurance?
Correct.
Okay.
So then we offered them the Medicaid insurance. And to get Medicaid, they have to submit all documentation to be eligible. Because of Medicaid being covered, they have to pay what the Social Security benefits they receive monthly for Medicaid to cover the full amount
So they have to take their benefits and pay that towards.
to the facility. For some,
Okay, so let's go back real quick. So did they file an application for
They did.
Medicaid?
yes, they did.
And they submitted all their documents and were they approved?
They submitted some documents, not all documents.
So did someone help them with this application?
Yes.
So how did that happen?
His name is Jody. He did the application for them. He requested all needed documentations and not all of them were given to him. And we do have a certain date for Medicaid to get it approved. And because it wasn't given during the due date, then it got denied for a married application, but it got approved for a single application.
No, their
benefits.
social security benefits to the nursing home.
Correct, yes.
Or is it just because it was single, just his benefits?
It would be just his benefits. I apologize.
Okay, just his benefits. Okay, so she could keep hers.
Keep your correct, Kevin.
But the other way, the married couple, she would have to send her benefits
Her
and his.
information.
Well,
Correct.
that doesn't sound good. Then she couldn't have anything to live on. Okay, he has it as single. Well, did he send all his benefits?
He would pay some, but not the full amount.
So he didn't pay any of his benefits, therefore
There was some benefits paid, not the full amount. So we send statements, we tried to work with the family members, but there was nothing that could have been come together to be able to pay the full amount.
So did you all make him leave the facility?
No, we can't. We as a nursing home, we cannot do that. We cannot set a discharge because someone cannot pay,
So they were just racking up bills every day.
basically.
And how long was he there?
He was there until,
From November 2nd of 2023, right?
correct,
Until
yes.
when?
And then he stayed until 2025.
And what month or when did he leave in 2025?
He left on February 4th, 2025.
So he was there for 2 full years, and all this time, his copay's going $200 a month, $200. I mean, a week. I'm sorry, $200 a day.
So after 100 days, because Medicare A covers only 100 days, it switches over to Medicaid only.
Did they have Medicaid?
Yes, they did. After that, Medicaid got approved, and the Medicaid was able to cover the room and board stay
From the 100-day.
after 100 days. Yes,
So they did continue to pay. Medicaid,
yes,
the insurance continued to pay, but the patient is the one that owes their part.
correct. Yes,
Okay. And that adds up to $13,060.77.
correct. Yes.
Miss Owens, what's
Yes,
going on?
Yes, sir.
I got educated on
Yeah, well,
Medicare and Medicaid,
Yes,
so I
do too,
appreciate
Lauren.
that.
But my husband Leroy was in their therapy at that,
Mhm.
and he's not here today because he can't walk, and I don't have anybody to help me.
Okay,
But
that's fine.
I noticed you said Leroy was there until February 25. Leroy left Northeast in June.
Okay, so tell me when did he arrive and when did he?
He went in. It was right after his birthday. I want to say end of October 23. Might have been.
She said
beginning of
November. She said November 2nd. So
Okay, well, it was right after his birthday.
okay,
And he stayed there until June or July 24. At that time, they transferred him to Encompass. They called me in the office, I guess, first when he went, he had United Healthcare, A and B. During the course of his time when he was there, I came in and they had given him card for prescription. I think they had a manna. And I'm like, well, what is this? So the lady, some lady, I don't know, said that while he was there, all his mail went to them and they changed him to Medicare. I never knew to this day, standing here, that he had Medicaid, because I just applied for him for Medicaid just in February. So I never knew at any point that he had received any kind of Medicaid of anything. They called me in a meeting and told me that I was going to have to start paying. So I said, okay, well, whatever I need to pay, let me know. So I believe I started paying January or February.
Of what year?
Of 24.
Okay.
And that's what they told me I needed to pay, $656. And that's what I was doing every month. And when they discharged him, nobody came to me and tell me that I had still owed such and such and such. If they had, I would have offered to continue to pay the $656. And that's all I know. Because they never talked to me about payment at all until they got ready to transfer him to Encompass. And that was about January. So he left in June and I paid every month $656, what they told me to pay.
December of 2023, she was paying $676. That's what she was 56. That's what she was told to pay, right?
Yeah, that's what.
And she paid it all the way up through what?
To make, because he left in June.
May, that was the last 656 payment, and then on June, she paid 437 with 40 cents.
They transferred him to Encompass. He stayed there 14, 16 days or something, and he came home. And we gave him a parade and everything, so he was home in 2024.
We're missing a lot of months because what the plaintiff just said is that he was in
LeRoy was at.
facility. No, I mean, basically in some facility between November 2nd and February 4th of 2025.
No, ma'am.
So that's
no, Your Honor.
over 2 years.
At home.
So
LeRoy was at home July, coming home parade in July of 24. LeRoy was at home. LeRoy's been at home with me.
okay.
He was not in
So-
anybody's nursing home in
Where
25.
was any proof that he was in the
This is just
facility? Tell me
26.
where he was in the facility. He was at home. How could he be at a facility?
Yeah, that's what I want to know.
Statements that we were mailed out to.
I don't care what your statements say, honey. He was at home. And they never gave me, when I went in to pay,
Just invoices.
they just took his debit card and gave me a receipt. There was never nothing saying for this or for that or for this, for that, you know. And I'm not saying I don't owe it, but I'm just saying.
Yeah, all these are just invoices. Invoices. It doesn't show, I need to show when he was admitted, when he was discharged. Your invoices, the end is July 1st of 2024. And you said he was there till February of 2025, and your invoices even show
Oh, I
that
think
Ms. Owens is correct, that he was out of there. But I don't see a discharge or,
Where's this parade? Lord Jesus, come on, parade.
none of this shows me when he was discharged, so that's not very helpful. So I don't know what this $2,260 is. I mean,
The amount is because no information was given for the marriage application, Medicaid application.
Your Honor, if I may.
okay, you just told the court, hold on one second, Ms. Owen.
Yes, ma'am.
You just told the court that because he was single and they didn't apply as married. Well, she says she doesn't even know anything about it, that y'all were just talking to the husband. So you didn't talk to Miss Owens and she was there every single day, which doesn't make sense to me when he's in the hospital, not feeling well, in pain. It seems like you would talk to his wife as well.
This was also previous to me, Your Honor, as well.
Okay, well, this doesn't make sense to me. It makes no common sense. It seems like you would talk to both of them. She didn't even know y'all were doing this. She did pay what y'all told her to pay.
Yes, ma'am.
And she was giving his social security to you all. It shows right here in her bank statements. You even have it here that she paid exactly what y'all told her to pay.
Exactly.
And you just told the court that all she needed to do, since it was single, is just pay for to pay his portion of the Social Security, which is what she did.
Which is also, there's another deposit of $2,000 as well, Your Honor.
Deposit $2,000 for what?
That's another benefits that they receive. So the total amount that should have been paid to the nursing facility a month was $2,260.
Yeah, but you just said that hold on, but you just told the court that he did get approved. And so that was being paid by Medicaid or Medicare.
Correct. That's when he got approved as single, not as married. So if he would have gotten approved as married, they wouldn't have to pay any benefits to the facility.
I'm going to take, this is going to be a take nothing, ma'am. I know that y'all reduce things and you all do work with people and you're not working with her at all. Nothing what you're telling me is making sense because you didn't include her. And if he is married to her, you should have included her with the documents and for her to bring in documents. How is he going to know when he's sitting there in the bed, doesn't have access to anything and in pain, and she's there and willing and helping to pay? This is a take nothing judgment. You have 21 days to appeal. All right, y'all may be dismissed. Thank you.